Many patients present to clinic with shoulder pain. It can affect their activities of daily living, like getting dressed, or it can affect their sleep patterns. Most commonly, people are suspicious of their rotator cuff muscles as causing the shoulder pain, but it can be broken down in two different parts of what could be causing shoulder pain. We can focus on the bones or the joints, and we can also focus on the soft tissue, which would be muscle, tendon, or ligaments. So, in focusing on the soft tissue, of course, we can have rotator cuff muscle tears or tendon tears of the rotator cuff, and those muscles work to move the arm above the head, behind the back, and in front of your stomach. Those can be torn or they can be irritated or degenerated just from basic wear and tear. You can also get calcium deposit in those tendons that can cause significant shoulder pain. And then, of course, we can have things like impingement or bursitis, which is just inflammation in that area that causes shoulder pain. In discussing the joints or bones, we can look at arthritis, and that's why we normally take an x ray before we see a patient to evaluate their shoulder pain. That usually has pain with range of motion and not just with sleep patterns at night. If the patient was in a trauma, we look for fractures or even dislocations or movement of one bone in out of place from the other bone. Some of the treatment options we do, depending on what the diagnosis is, could be basic physical therapy, steroid injections, and for more advanced injuries, possibly surgery.
Dr. Cisco, if a patient primarily has the problem of arthritis in their shoulder, what type of surgery would be best to address that?
Well, when patients present with arthritis, it just really depends on their pain and functional level. Some patients have very minimal pain, but they just want better motion in their shoulder. And for that, we would recommend physical therapy and even steroid injections. But when pain affects their activities of daily living or it affects their sleep pattern, a lot of the surgical procedures that we do are replacement surgery, also known as arthroplasty, in which we can replace the joint so that you can have pain free range of motion.